Namaste my dear children, I hope you are all safe. In the last class, we had seen accidents, fire accidents, how to prevent the fire accidents and how to put out the fire. This is the types of fire extinguisher. Okay, today class we are seeing about the first aid. What is first aid? The first aid means what? Help. The first help is the immediate help given to the injured person. Before taking the injured person to the hospital, we are giving the first help, that is called the first aid. Okay, first aid. Okay, what are the things we have to keep in the first aid box? The basic scissors, the basic tablet paracetamol, Dettol antiseptic cream, balm, gauze, and then thermometer. So these are the basic things we have to keep in the first aid box. This first aid box we are seeing in every place. Factory, school, home also we are seeing, isn't it? In case of major accident, this first aid only save many lives. So students, different injuries can be treated differently. Okay, என்ன மாதிரி இன்ஜுரிஸ்க்கு என்ன மாதிரி first aid கொடுக்கணும்? We are seeing now. First burns, second one cuts and bruises, fractures, sprains, animal bites, nosebleeds. So இது மாதிரி டிஃப்ரெண்டான இன்ஜுரிஸ்க்கு என்ன மாதிரி ட்ரீட்மெண்ட் ஃபர்ஸ்ட் எய்ட் ட்ரீட்மெண்ட் we have to give நம்ம இன்றைக்கி பார்க்கலாம். Okay, first whatever burns it may happen immediately, we should keep the burnt area under the cold running water and then cover the area with a cool or wet cloth. Okay, don't keep the ice cube on it. We have to avoid keep the ice cube on it. In case of severe burn, what we have to do? Immediately we have to take the patient to the hospital and then we have to give lot of water to drink for them. Okay, and then for in case burnt area, definitely we can able to see the burnt area. Definitely in this area the blisters can come, so don't prick the blisters in the burnt area. We have to avoid to prick the blisters. Next, second one, what? Cuts and bruises. Suppose any cuts, any wound happened by cut, what we have to do? Immediately we have to wash the wound by water and then apply the antiseptic cream. Suppose the cut is deep, what we have to do? We have to cover the wound with gauze covered cotton. Suppose the wound is on the hand or leg, in this area continues to bleed, what we have to do? Hospital போகிறதுக்கு முன்னாடி நம்ம என்ன பண்ணுவோம்? Immediately we are taking some cloth or any kerchief, we are trying to tie that place, isn't it? So that is called what? Tourniquet. அதுக்கு பேர் என்ன சொல்லுவோம்? Tourniquet. In this situation நம்ம என்ன பண்ணணும்? டை பண்ண உடனே immediately we have to take the patient to the hospital. The doctor give an injection to prevent a tetanus disease. டிடின்னு சொல்லுவோம் தெரியுமா? டாக்டர் டிடி இன்ஜெக்ஷன் போடுவாங்க உடனே எதனா ஒரு அடிப்பட்டதுனாலோ எதனா ஒரு கடிச்சதுனாலும். ஓகே, தட் இஸ் கால்ட். எதுக்காக அதை போடுறாங்கன்னா, இந்த டெட்டானஸ் எதுக்கு போடுறாங்கன்னா, ஏதாவது ஓப்பன் பிளேஸில் என்ன பண்ணால் சில பாக்டீரியாஸ்லாம் வந்து இன்ஃபெக்ட் பண்ணிடும் அந்த ஏரியாவை. த டெட்டானஸ் இஸ் எ சீரியஸ் இன்ஃபெக்ஷன் காஸ்டு பை தி பாக்டீரியா. ஸோ இதை அவாய்ட் பண்ணுறதுக்கு தான் என்ன பண்ணுவாங்க டாக்டர்ஸ் வந்து they are giving some injection. And then fracture, the bone broken by some accidents. It may happen, நடக்கும்னு சொல்ல முடியாது, it may happen. In this situation immediately we should not allow the person to move. என்ன பண்ணலாம்? We can keep the ice pack on it, it bring down the swelling. Or and then doctors கிட்ட கூட்டு போனா என்ன பண்ணுவாங்க? They are using splint, it helps the broken bone does not shift. This is sling also made up of cloth to prevent the movement. Suppose sprain can happen in the ankle or wrist joint area. Okay, the joint swells and getting severe pain, that is called the sprain na என்னது சுளுக்குன்னு சொல்லுவோம், that is called the sprain. So இதுக்கு என்ன பண்ணலாம், we can keep the ice cube on it, it helps to decrease the swelling. So wristல ஆச்சுனா இந்த மாதிரி wrist bandage இருக்கும், ankle bandage, everything we can use. Next, animal bite. It is very dangerous. Why? Because the kinds of germs live in the mouth of animals. This animal can bite, it leads the rabies disease. Okay, suppose any animal bite anybody, immediately wash the place with soap and water. யாருன்னா கடிச்சதுன்னு தெரிஞ்சால் ஃபஸ்ட் என்ன பண்ண, we have to wash the place and then take the patient to the doctor immediately. The doctor gives some injection to prevent the rabies disease. In the case of venom snake bite, okay, venomous snake bite, ஏதோ ஒரு பாம்பு கடிச்சதுன்னா we have to use splint to stop the venom spread to the entire body. நம்ம என்ன பண்ணுவோம், ஏதாவது துணி எடுத்து கட்டுவோம், let the patient and then என்ன பண்ணணும், patient lie down பண்ண வச்சுட்டு படுக்க வச்சிடணும். Okay, why the bitten part is swell below the level of the heart. அது நல்லா படுக்க வச்சுட்டா என்ன ஆகும், அந்த பாய்சன் அந்த வேணும் வந்து ஹார்ட்டுக்கு மேலே ஏறாமல் இருக்கிறதுக்காக we have to keep the person lie down and then use splint and bandage to stop the bitten part from moving. We should not tie any cloth or splint on the bitten part. Okay, above or below we can tie. And then we have to try to suck out the venom. Okay student, and then nosebleed. It can occur due to the accident, irritation or dryness, anything. So இதுக்கு என்ன பண்ணணும், ask the patient to lean forward slightly. கொஞ்சம் முன்னாடி போயிட்டு என்ன பண்ணணும், நம்ம ரெண்டு இண்டெக்ஸ் ஃபிங்கர் அண்ட் தம் ஃபிங்கர் வச்சுட்டு நோஸை நல்லா அங்கே பிக்சரில் பார்க்குற மாதிரி நல்லா மூச்சை இழுத்து விட்டால் என்ன ஆகும், ப்ரீத் பண்ணிட்டா என்ன ஆகும், 10 minutes பண்ணிங்கன்னா ப்ளீடிங் ஸ்டாப் ஆகிடும். These are the first aid for the given accidents. After given the first aid, we can take the patient to the hospital as soon as possible. So you have to keep with your mind all those things. Okay, I will send the worksheet along with this video. You have to do it. Thank you, my dear children. What values do you learn from this lesson? Yes, self-awareness and then helpfulness. Okay, I will send video along with this video. You have to do it. Thank you, children.